Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Hello, sir.
Hello, ma'am. How are you?
I'm all right. It's been a busy weekend, and I know that you want to get right to the numbers today because we're seeing some things for the first time that we've not seen quite yet. You want to pull those up?
Sure. Give me just a moment here. So hopefully you can see this right now. And these are the daily numbers that were reported by Indiana State Department of Health. Shows we have 65 new cases today just for Hamilton County. We can go down here and validate that that's just for the county. And when we look over here at this yellow bar, these are the number of cases that were reported today. One thing to keep in mind is that these numbers do change from time to time as more information comes in. If the person got tested here but actually lives in another county or something to that effect, sometimes people do get double reported. It is possible. So that number can change from time to time. But one thing to look at is this graph down below, and we can see these extra blue bars starting over here on 8/24. They added 101 new tests all the way through the week. They've added those in. And what happens is folks batch their information. So they have a group of numbers that get sent in one day a week or whatever the case may be. So if I were to get tested on the 24th, but my test didn't get reported until this morning, I would be considered a positive for the 31st. Or in this case, we'll just use this case of the 30th. If I got tested on the 24th, but my positive case didn't get reported until the 30th, my positive would go on the 30th, not the 24th, when my test was actually taken.
You want to scroll down to those age groups too? Something
Sure.
happened today we haven't seen yet.
So right here are the age groups and the number of positive as a percentage. And we can see that the 20 to 29-year-old group still leads the way. This is the first time that any particular age group has exceeded 20% of the total number of tests. And I think that's, there's multiple factors, not just one thing. We have talked a lot the last couple of weeks about the social interactions and things like that. But I do think it's also important that we mention that, the students have been going back to school. And one of the requirements for the colleges and universities is that they have a negative COVID-19 test before they resume classes. So we have seen a lot in that 18 and up age group that have gone to get tests prior to going back to university. And my suspicion is there was a lot of asymptomatic folks who didn't realize they were positive, went to go get their test and got some unpleasant news that they weren't going to be able to start on time with their peers.
So between them and that teenage group, the 0 to 19, you're looking at 40% of brand new cases. What do you attribute the 0 to 19 climb to?
Well, and if I remember correctly, Dr. Box a few weeks ago or last week mentioned that the vast majority in the 0 to 19 age group are actually 14 to 19 years old. And, one thing to look at is what do the majority of 14 to 19-year-olds do on their summer breaks? They go out and get jobs. They go out and work in the community. They hang out with their friends, things like that. So I don't necessarily know what percentage of that 0 to 19 would be 18, 19 years old college age kids versus the 14 and up, 14 to 18, which would be your high school age kids. And then, obviously 0 to 13. I don't have that information, but I think if we look at that, knowing that 14 to 19 is the majority, you start looking at what their behaviors are in these last few months, June, July, and now through August. And that's typically what you're going to see those teenagers doing, is socializing and working.
Some people would look at that number though, Chris, and say, then why are our kids in school? Why are we exposing them to one another? But I think as a health department, we feel pretty confident there are fewer places for our kids to be that are safe than a school building right now.
That's right. And we have regular communications with all of the school districts, usually multiple times a day. Our health educators, our public health nurses are working constantly with each school district to look at what's going on within each district, let alone each school, even each classroom sometimes, to do everything we can to safeguard those kids. And, we think that along with the governor, Dr. Box, and everyone else, that the best place for those kids to be is amongst their peers learning right now.
But they need to be real careful about what they're doing outside those school walls. And we're coming into the Labor Day weekend. Talk about that a little bit.
Sure. So, it is a long weekend, and we've seen, if we can go back up here real quick, we go back to early July here. We'll remember that we went into phase 4.5, I believe, on the 4th of July. So here's the 4th of July right here. And we go all the way out to the 18th, which would be 2 weeks. We start seeing that climb. That 14 days is the 2 to 14 days for symptom onset. So we would highly recommend that folks continue to maintain their own little bubbles, their social bubbles, try and have a good time, but please make sure you're doing everything you can. Wear your face masks and social distance when you're not around your immediate family and your immediate social network, and help keep each other safe.
Yeah. So next week, there's a little bit of a change to the state testing site there in Noblesville. Tell us about that.
Sure. So we were just notified today that they've got to do some work on the building at 400 Lafayette, and it's going to require us to move out. The good news is we've managed to keep the doors open, so to speak, on testing and keep those 3 days active. Wednesday, Thursday, and Friday of next week, it'll be closed. And what we'll be doing is we'll be setting up some of our tents that we have for multiple other events, setting them outside. They will be have HVAC. They'll be air conditioned or heated as needed. They will have electricity. Just instead of going in the building, you'll still park in the same area, in the same parking lot, same address and everything else. You'll just proceed inside of the tent and go through your test like you normally would. And we're hoping that early next week, once we get that stuff set up, we'll have some pictures and video and stuff to push to social media.
But the presumption is then they'll be done with the work over the weekend and you'll be back in that building again afterwards.
That is correct. We're hoping that by Monday, the Monday after Labor Day, that we'll be able to get back into the building and resume normal operations through at least the end of the month.
Chris, any other thoughts? Anything to keep in mind as we head into the rest of this week?
We still have testing available 5 days a week, 8 to 8. Anyone's welcome to come in. LHI.care/COVID testing to sign up. We are still accepting walk-ins, and it's one of the few places that I know of right now that is accepting walk-ins. You can be asymptomatic and you're still getting your results typically in 3 to 4 business days.
All right, Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department. Thanks once again.
Thank you, ma'am.